Welcome to the Global Robotic-Assisted Surgery podcast. I'm Professor Hitendra Patel, and I'm welcoming you to the multiple episodes we have over the coming weeks and months. I hope you enjoy. Welcome to the next episode of the Global Robotic-Assisted Surgery podcast. I'm delighted that today's subject is on the field of robotic-assisted surgery in ENT, or ear, nose and throat. And I'm delighted to have the global superstar in this field, Dr. Kalpana Nagpal. Welcome, Dr. Nagpal.
Thank you, Dr. Hitendra. Thank you again for the invitation.
It's an absolute honor to meet you. Your CV is so illustrious. I don't know where to start. And that's just your work. Where do we go with your philanthropic work? All the other things that you do outside of that. I mean, it's just incredible. So I think the easiest thing to do is if you can just tell us a little bit about your journey, including, please mention all the awards as well, because I know you've got a lot of them on that journey. Thank you just for that little intro for our listeners and viewers.
Well, journey, you mean all over from childhood?
You can start wherever you like. I think lots of surgeons that I know, they want to know what drives people for the success that they've achieved. And I think that starts in childhood, to be honest. If you're happy talking about it, yeah. I mean, I'd be lovely to hear a little bit about your childhood background and then how you got into where you got to. Because I know you've had a lot of fights in your time, but you've had lots of amazing things happen also. So the sweet with the bittersweet, let's call it that.
Well, in my family, I was the first doctor. Nobody before me became a doctor. So I was motivated by my uncles, and we belonged to a middle-class family, and my father was struggling to meet up with all our needs. I had two siblings. And I went to a school where it was co-education, meaning male, female, both. And I used to always like to participate in competitions, especially sports. I was this Kho player. I represented the state where I was in schooling, like at state of Tamil Nadu. So this Kho made me, active and more competitive. And I used to always love winning those prizes, medals, a gold medal in Kho, and similarly athletics or whatever, that used to boost me. And yes, studies, I wanted to appear for both. Those days, people only spoke about either becoming a doctor or an engineer. If you did well, only these two options were known. So my parents were very keen, and I thought, let me try short, meaning, try both. So I appeared for both the exams, and I was lucky. I got selected for both engineering and medicine. And engineering, the top IIT, it was supposed to be, people thought I was very brilliant, and I don't know how it was happened. Maybe there was a luck factor. So I succeeded in both the exams. And so for a few months now, since engineering started first, I was in Bombay IIT for about 2 months. And I enjoyed it, but for some time. But after that, when it got into serious studies like fluid dynamics, etc., then I thought, oh my God, this seems to be, not my interest. Meaning, I wanted to see patients, talk to them, and be rewarded by them. So then I suddenly switched over. Since by then the results were out for medicine, and I joined medicine. Well, so I had to go to a different state because I got as a non-local student, and this was Osmania Medical College. And the struggles those days were way too many. I had a small bicycle. I used to go use that cycle to the classes. And otherwise, from home to college, it was going by bus, which I can, nowadays, like my daughter has never been in a bus or a train, because when they're born, everything is ready. Whereas we had those kind of challenges. And so every day sweating, going to libraries, even affording books, believe it or not, I used to borrow them from British Library. And and that's how we studied, secondhand books. And So anyway, and the reading was much more, we didn't have YouTube videos or, all that is available now. Now the students have a different means of education. So ours was more reading the textbooks, reading books. And so that kept on. And after MBBS, then I had to go for post-graduation. And again, there was an entrance. And believe it or not, again, I gave an entrance for post-graduation of engineering as well as, which was called MTech.
Wow.
So, because I thought, let me try and appear for biomedical engineering, because that's when it started, biomedical engineering, a new field. So I thought, let me write the entrance exams for both. And interestingly, again, I got selected in that. People were surprised because there were only 2 doctors in that class for biomedical engineering. So, and so anyway, I quit and then took up otolaryngology, and MSc ENT was for 3 years. And after that, well, it was clear that people said MS alone would not be sufficient. You still have to study, And so then that's how I took up fellowship. And it was the first time international travel all the way via Frankfurt to US, so long travel. And it was very interesting. I met up with one of the best sinus surgeons, Dr. Frederick Kuhn. He was in Savannah, Georgia. And from there, I did fellowship for sinuses. And then I also moved to Atlanta Sleep School of Medicine. I learned some techniques of surgery for sleep apnea. And then I returned to India. I was also married, so it was not easy. It's not like everybody said, oh, okay, you can go and you can be away from the family, give you permission. It's not so easy. In-laws were hesitant sending me because this. Oh yeah, you're married and you have a lot of responsibilities. You can't just leave like that and say, I'm going for fellowship. And that's the reason I couldn't do FRCS. So whenever I see, now you have this FRCS degree. And so when I notice that, I always feel bad. Oh my, why did I miss this? It was only because I was not encouraged. Anyway.
Oh, you can pass it now. It's so easy. You'll be fine.
Thank you. So after doing that, then came back to India, and not easy again, because you start from scratch. You don't know, you start from the first patient. Of course, there are other challenges for women, like pregnancy.
I'm so sorry. Just before we get on to the challenges for women, I want to know this because I know about your journey. But just before we go there, I just wanted to just say one thing. Engineering has been a part of your life since you were young, right? The engineering, IIT, then the biomedical engineering. In fact, you're a surgeon. You're actually an engineer of the body. So actually, you're an engineer. So you've made it. All right. I just wanted to say that to you. Okay. You are definitely.
It was touch and go, touch and go. I didn't do the entire engineering. It was a couple of months, but yeah, I think so, because some of my colleagues even now keep telling that when I put because of your IIT that you're doing robotics.
But like you, I worked as an apprentice in mechanical engineering in my father's garage. We fixed cars. So I actually did. You and I have had a similar journey. I was an engineer also, but with my hands, not my. I did a few exams and then I went to medical school. So, but not to digress. But I'm very, very interested to know about the next part, your journey as a woman in surgery, particularly as recently in the UK, a huge news story broke here about the difficulties that women have with their male colleagues, sexism, prejudice, etc. And I mean, I'm disgusted by what I read, but it's in all the national newspapers. And when I talk to my colleagues who are women, 1 in 3 women have had some kind of sexual encounter they did not wish to receive while they're working with their colleagues in our world, in the surgical world. So please, I'll be interested to hear your thoughts on your journey and maybe on what I've just said.
Yeah, thanks for letting me say that. Now, so when I joined and when my private practice began, so now already since I was doing some ENT work, though not in large volumes, little, now something happened to my spine that I had to go for a major spine surgery. So L5S1 discectomy. Now that made me bedridden, and after that I had to go for IVFs and, a lot of challenges, of course. And then when I had my daughter, again, I was only doing part-time job because, taking care of a small child, at least until 5 years of age is very important. And then I send her to daycare. So with these kind of extra challenges, yes, I continued. I was trying to compete with my male colleagues. And I wasn't welcomed when I joined a corporate setup as a senior consultant. It's not like, hello, Dr. Kalpana, welcome to our department. It's nice having you. No, nobody said that. And for 20 years, I've remained the only woman in this department. It's only very recently some other lady has joined. Otherwise, for 20 years, I was the only woman. And yes, all over, women all over have their own share of problems. But, I don't like to bring them to work because, it's like you can take half, French leave, you call it. You do work for 2 hours and then you say, sorry, my baby is crying and I have to go. No, it's
Yeah.
not fair. Because even men can do that. They can say the father is required and I have to leave. No. So these kind of excuses I never made. So I was working hard even in the evenings if I was assisting some cancer surgeon. And if I have to be, doing more than the work hours, I would be doing because I would like to learn. And so I was very sincere. And after that, when I had my bus journey, when I go back home, I many a time would forget my stop and I would sleep and I would go two stops ahead. Oh my God, and regret and take a bus back. And I've done that several times. You try to keep wide awake, and then when you're closer to your stop, where you have to actually get down, you go to sleep somehow because you're tired, you're working all day. But anyway, today God is kind.
Yeah. Well, listen, I was going to say you have it, and I think you need to write a book about your journey because I think it's just fascinating, and there's loads more we can talk about. But we better get on to your actual pet subject, the thing you are known for, the thing you're an expert in, the thing you lead, as you said, as a proctor, the thing you actually started in your hospital, the robotic-assisted surgery in ear, nose, and throat surgery. It's I would say it's relatively new compared to something like urology urology is the one. The rest of them are all new. But in terms of volume and those sort of things, I found my colleagues said it's quite tricky to get a volume of surgeries together. So it'd be really interesting to hear your journey in robotic-assisted surgery in ENT. So maybe we could talk a little bit about that. So first of all, when did you start? How did you start? And who did you start with? And what did you start on?
Right. Good questions. So I started in 2017. And by then I was observing all these urologists, meaning only from a distance, I would only keep listening to what's happening. So this somehow motivated me. And then I thought, okay, let me go. And then I went to Korea, where it's not an English speaking country. So you have to keep referring to Google. They're very helpful, but they can't speak English. So it was, again, a struggle. And then I used to look up, I go every day to Yonsei University. Yonsei University is very good for training. I would still recommend youngsters for that. And, I was lucky within 2 days after, by then I had already got my console certificate. So I was practicing on the simulation. Yeah, I was doing the simulation. Good. And those dots, you play those, it's like a video game. You do all those exercises. And once you pass your exercises, whatever test was there, so that was easy to pass. And then I got this console certificate, and that's how I could enter the Yonsei University. And there, when I was tested, I was lucky. Within 3 days, I could call back home and say, well, I've passed the basic training. So then I stayed back for the advanced training for another 1 week, and that's about it. So yes, this motivated me. But then when I returned, there was a lot of criticism. He said, robotic surgery, what is she going to do? I don't think it makes any sense. Traditional surgery, versus robotic surgery, I don't think there are any benefits. So nobody believed me. People didn't believe me almost for 1 year or 2 years, because I had to prove myself. I had to prove the benefits. I had to show them the outcomes. And only then people started believing. And now I get referrals. For example, you asked me which one was the first one you started. I started with sleep apnea surgery first. Okay, sleep apnea surgery, especially people, got best results because of the midline glossectomy. Now, midline glossectomy happened only because of robotic surgery, because there's no external cut involved, and you remove a good 15 to 20 ml of cc of, tongue base. And the patients are very happy after that. It's such a gratifying surgery because, well, the case selection is very important. If the BMI is less than 35 and you made sure that there is no trismus, and then the apnea hypopnea index that we look for is less than 50, so we only picked up mild, moderate, and early severe. Not very severe cases, because then those cases only needed auto CPAP or BiPAP depending on the requirement. So as I started doing sleep apnea, interestingly, there were more coming because the message spread. It was by word of mouth. Now in India, creating awareness has been so difficult. It is still difficult. And then I started now, interestingly, in the first 1 month of doing the surgery, there was a girl who came from Nepal who had lingual thyroid. And our lingual thyroid, again, and she had it in the base of tongue. And now a 16-year-old female without an external cut. Now the parents were so happy, ecstatic, and the lingual thyroid came out easily in 25 minutes without any blood loss. So they were very happy because she was unmarried and, without a scar in the neck. And that's how, again, more and more people started believing within the hospital.
So,
and then I started expanding the indications.
Yeah.
So
I was just before you do, I was just going to say the resistance you felt when you first came back, that resistance, that what are you going to do with ENT and robotic assisted surgery? That resistance has happened in all specialties in surgery. And then you may remember one of the most famous things that's ever happened in surgery was gallbladder surgery, when there was a paper, a randomized trial published showing that a minimally invasive cut gave the same outcome as a laparoscopic operation. So they were trying to say that open surgery is still as good as keyhole surgery. So this fight's been going on. Change is so difficult. Change in behavior is so difficult. We've talked about many of these things, you and I, this evening, but changing things is very difficult, and it takes someone with courage and a big heart and a kind heart to change things. And I believe that to be you. So I'm so sorry to disturb you. I think you are just important that I say that because history, you're just describing history to me.
Thank you. It's also, the percentage of robotic surgeons. We are much smaller in number as compared to the traditional surgeons. Obviously, they're large in numbers. So whatever they said was believed, and said was less.
Kalpana, should we not just say everybody's a surgeon and the robot's just a tool, rather than calling ourselves robotic? What do you think? What do you think about that?
Absolutely. No, robot is just a tool. And of course, it's no more just a tool. It's become more sophisticated, but it's still a friend to us. And yes, we are first a surgeon. We're first doctors. And we need to treat our patients with all empathy. So tools are just additions for our theatre.
We'll agree that the robot's our friend. I like that. So we'll say that.
I never like to call it master-slave system, though it used to be mentioned often. It's a friend.
Okay, so I'm going to change my language. You've changed me. My behavior's changed. You see, it works. It's working.
You're so humble. So and slowly then I started expanding the indications. Then of course, even today I did a case of base of tongue hemangioma. Hemangioma is a very vascular lesion, and when you do the case without arranging for blood transfusions, and when you show the suction jar to everybody saying, look, it's empty after doing a hemangioma surgery, everybody smiles then. The anesthetist is happy, your assistants are happy, your juniors are motivated. And that's how I started cultivating. People started praising for the work. And that's how today I would be more satisfied than what it was in the beginning. In the beginning, there was a lot of resistance, a lot of criticism. Yeah. And especially because I was all alone. It's not like we had, more robotic surgeons to support me. Yeah. So in Otolaryngology, as I still say, we are not a handful of surgeons even now.
So you bring me on to nicely onto the next part of the question. And that is, we talked about how you implemented and got things going with all the resistance, but you got it going and you motivated your group. But in the other side of this coin is people coming. So the cost of robotic surgeries per operation is significant. We can't get away from that. There is a cost associated, and it's significant. So the type, how do you think, what can we do, I should say, sorry, a different way. What do you think we can do to bring robotics to the masses as opposed to the elite kind of patient?
In India, the scenario is totally different. You guys are lucky because you have insurance coverage. Now, in India, robotic surgeries were never covered through insurance. Recently, only this year, coverage has started happening for urological surgery, like for prostate cancers.
Yeah.
And for otolaryngology, yet there is no coverage. So what I had to do is I had to sacrifice, in the sense, I won't call it sacrifice. I kept my surgeon fee as the same as the traditional surgery. It's not like I'm doing robotic surgery, I'll charge the patient more. No. Otherwise, I would not have had these volumes. So my surgeon fee remained the same. The patient had just to pay $1 lakh extra for the robotic consumables, 1 lakh rupees in India. So which means that is a significant amount, but patient is paying only for the consumables. That way, when you explain to the patient that, see, look, I'm doing a new technology surgery. The benefits are so and so, but I'm not charging you extra. You're only paying for the consumables. Yeah. So that's how patients get encouraged.
So for our viewers, 1 lakh rupees is 100,000 or approximately £1,000 or $1,200 US.
Thank you.
Okay, so that's very noble as well of you. But the companies that sell you the machines are still making their profit no matter what you do, right? So Absolutely. So tell me, so we're doing all the work. We're implementing safe surgery around the world, people like you and me. And you've just told me what you're doing. Insurance covers it in parts of Europe, but actually our taxes are much higher here also. So the public sector now provide robotic surgery by the taxpayer, so the public sector. So people who can't afford to pay, they go in through, like in England, the NHS, the National Health Service. So there are different models. That's not what my question was. My question was basically how people access this type of surgery when it's not really available everywhere. So India's a huge country. And so do you get patients coming from all over India for surgery, or is it particular areas?
Well, interestingly and delightfully, I would like to say now, people are coming even from outside India. For sleep apnea surgery, there were 2 doctors who came from Malaysia all the way, wow. Having heard that. Yeah. So they came for sleep apnea surgery. Similarly, I had a doctor from Iraq, and there were a few high-level dignitaries who came from Africa, from different parts of Africa. So because of awareness, there are people coming from Canada. I mean, what they say is it's more expensive there, and that's why they chose me. So that could be the reason. And Eastern countries, and also people from Russia, Nepal, Bangladesh. So I'm also getting significant number of international patients, and which feels good. I mean, feels nice.
But
it's because of the awareness.
Are they coming because there's a robotic-assisted system in your hospital, or are they coming for Dr. Nagpal?
Well, in otolaryngology, I think it's because of Dr. Nagpal. I mean, yeah.
I'm going to say they're coming for you. And you're not going to argue that one. There are loads of systems all over the world, but these people are coming to you for a reason, right? I know your reputation is phenomenal. So let's move on. So we talked about your journey. We've talked about you. Thank you for those parts. We talked about some of the resistance, but also the success. You've actually successfully implemented robotic-assisted surgery in ENT in your facility to an international audience. That's a fair summary of you, would you say?
Thank you. I'm humbled.
So what about the other side? When you're not working, what about your philanthropy and the other thing, the many things you do? Just tell me a little about that before we finish.
Yes, I would love to see the nurses happy. Nursing Federation, I always felt are much more hardworking than doctors. And they're also less paid, at least in India, they're less paid and they're working selflessly. So it's nice to see them smile. And so what I do is I try and organize some cultural events for them and try and provide some, assistance, like, providing them washing machines and microwave to heat food, etc., at workplace so that they can have hot food too. So these things always keeps me happy. Like I try to keep, doing this for nurses. And the other thing I like is in whatever in my capacity, if I can help people get jobs, because there are so many jobless people in India, even doctors, there are people who have had postgraduate qualifications and yet they're not settled. So I try and do my best to, guide them, mentor them, and provide them a job, or they could be joining me in my team. As far as possible, I try and do this. But the best thing that happened was during COVID times. So I'm sure this happened all over the world. Everywhere we were seeing it on news that there were lack of beds and patients were struggling for admission. And most of the time, even if oxygen saturations were dropping, people were waiting, it was a huge waiting list. People were not getting beds in the ICUs, etc. That was the time, this was the second wave in India. It happened in 2021. And people were dying left and right. It was too much. It was too much of tragedy all around you. And that's the time I thought I must do something. And I went to all the government buildings which were actually closed because people were not working, but somehow I couldn't get any of those institutions opened up for this kind of work. So then finally I looked at schools as an option, and one of the government schools, the principal let me do that, and then the government school, I completely converted that into a ward, put as many beds as possible. I think I put some 60 or 65 beds with ventilators, and quickly I spoke to a lot of junior doctors, and I said, of course, they were all fresh postgraduates, and they knew how to treat COVID patients. And I gave them incentives. I said, well, if you work for so many hours, you get so much money and all that. So they were happy because they were going to make some extra money. And so that way I created a team. And so we could take care of a lot of COVID patients then. And,
Wow.
thank you
Amazing.
coming from those people. Yeah, people really were very happy that we could, and at least we were a stopgap arrangement, when the bed would get vacant, and if the patient deteriorated, we could then shift to a bigger hospital. So, but then we could manage as much as possible, even severe cases, and people were discharged happily, and we could do a lot of good work. So that is still on my mind. And my daughter helped me. Every day I would get night calls from that COVID center, that so-called temporary COVID center. And my daughter was also doing my night duties, duties along with me.
Wow.
So, and that's how she got motivated,
Amazing.
and she took medicine this year. She
Oh,
joined.
amazing, amazing, amazing. Oh, wow. That's a great. Well, listen, I could talk to you forever, but on that note, thank you so much. We should celebrate you, celebrate your work, you as a human being and as an absolutely amazing surgeon. So on that note, I want to thank Dr. Kalpana Nagpal, who was our honorable guest for the robotic-assisted surgery in ENT subject today from the Global Robotic Assisted Surgery podcast. Thank you and good evening.